and I am very excited that we get to share and present our first award. I think this is one of my the most exciting parts of the leadership conference every year, is to brag on and lift up and shine a spotlight on the people who are doing amazing work on the ground, whether that's research or treatment or prevention. It really has been an exciting part of what we've done at APF. We really feel like it's important. This is a tough field that we're in. It's a tough issue, and those that are dedicated and work on this every day, helping patients and families in a number of ways, are really sort of the heart and soul of what we do. So I believe Dr. Jim Barry has joined us, and I'm going to say a few words, and then would love to hear from you, Dr. Barry. And we also have a video segment that's a bit of a surprise, where we have some of your colleagues and others who have given some input. So Dr. Jim Barry from West Virginia University, who is an amazing physician and has helped so many people treat their substance use disorder. He's a compassionate and lovely, caring human being. And the folks that I've had a chance to connect with who have worked with Dr. Barry on their own treatment plan, their own treatment of addiction, can't say enough amazing things about him. Us at APF, we've been working with Dr. Barry for quite a few years now. His input and insight into our projects and our clinical pieces, our research studies, has been so helpful. He is kind and smart, and I think is probably one of the most wonderful human beings I've ever had a chance to meet. So being able to recognize him today is really special. A little bit about our award. Dr. Barry is receiving our Pillar of Excellence Award for treatment, for treating substance use disorders. And a little bit for our network on the why we call this the Pillar Award. On our very first conference that we actually had like pillars on the stage, and it had labels of things that we care about, like science and families and treatments and innovation and hope, and the things that we care about. And really the Pillar Award is about recognizing and celebrating the pillars in our community that are the foundation of the advancements in the work that we're doing on the ground. You are the reasons why we are lifting the field up and seeing change and starting to really feel kind of a fundamental shift on how we address addiction as a health condition, how we do a better job across the board, and being able to award you, Dr. Barry, with the Pillar of Excellence Award for treatment is really a highlight for us. So I think we're going to surprise you, if this works okay for you, on the sequencing of this. We'd love to share a very short video on your award, and then we'd love to hand it over to you just for a few remarks, if that works okay in terms of timing. All right, let's go. Haley, can you share the award?
I want to congratulate Jim Barry on his recognition. Jim has been an amazing leader, not only for our university and our health system, but truly for our entire state.
I couldn't possibly capture all that I have learned from Jim in just one short video, but here's a few of the highlights. I've learned how to treat patients with the absolute utmost respect and compassion. I've learned how to grow a pretty standard psychiatrist beard and mustache. I've learned how to treat my colleagues like family, and I've learned how to not let a lot of gray hairs stand in the way of me believing in myself.
The challenges for those with mental health conditions has been magnified during the pandemic, and during this time, Dr. Barry and his team have risen to the occasion and met this challenge by rapidly converting in-person visits to telemedicine visits so that people would have access to mental health and addiction professionals during the pandemic. Dr. Berry has also been an important leader for our research team with innovative first-in-the-world clinical trials using focused ultrasound and deep brain stimulation to combat opioid use disorder.
I'm Dr. Mark Gold, and as a previous winner of the Addiction Policy Forum Pillar of Excellence Award, let me tell you how excited I was to hear about Dr. James Berry winning this award. In addition to being a stellar clinician, a great teacher, role model, and mentor, Jim also has been pioneering new approaches to treatment, from the use of transcranial magnetic stimulation in addiction recovery to even deep brain stimulation in cases that are refractory to all treatments.
Jim is an incredible caring leader who is exceptionally skilled at delivering outstanding patient care, shepherding many people with addictions through their life journey to one of sobriety and one of success. We believe deeply that each person in our state who suffers from any kind of behavioral health problem, including addiction, deserves to be treated like we would have somebody in our own family. And Jim Berry does that.
His patients really deserve a seat at this accolades table too, so I reached out to a few of them to get some feedback, and this is what they had to say. One patient remarked, "He is absolutely the best doctor I have ever worked with," while another stated, "Oh, he is never wrong." And of course, a few patients commented on that beard, good Lord, that beard. One patient in particular had this to say about him, and I know her sentiments are echoed by many. "I feel like I could trust him from the moment I met him, and I knew in my heart he didn't judge me for being an addict. Instead, he showed me respect and compassion. Dr. Berry isn't just a doctor, he's an advocate for those of us who have few in our corner. I know that at my appointment with him, I'm not just another patient like a number, but that he actually sees me. He saved my life."
Raleigh and I worked together to say a few words in honor of you in this special occasion, and to make it a little easier, I'm going to speak on his behalf. Congratulations, Jim. We heard the Addiction Policy Forum was looking to award those who shine in the world of addiction medicine and policy advocacy. And, well, Raleigh couldn't think of anyone more deserving or who shines more on behalf of the patients and families struggling with the disease of addiction. When I talked to Raleigh about the words that come to his mind when he thinks about you as a resident mentee, a colleague, and now the one who has taken the torch Raleigh kept lit for so long, these were the words that came to him. You said, "Class."
Very smart.
Class and smart. You think Jim Berry is classy, and you think he's smart.
Very good.
Very good. Now, speaking for Raleigh, I'll tell you what I know he would say to you in honor of this accomplishment, if his words came to him as easy as they did before. You would have said to Jim, "Jim, I couldn't have asked for a better resident to mentor into the roles you now fill. Your success is largely due to your servant's heart. Not only do you have the skill to lead these efforts to which you are so formidable, but you have the heart to lead. But yet there are three important cornerstones that I taught you that I know continue to drive your work today. And with these in mind, you'll continue in your success in saving the lives of so many. You were a sponge, and you believed me when I told you, 1, addiction medicine is medicine's best kept secret. You are treating and advocating for a population that many other physicians prefer to avoid. 2, with the right treatment and support, patients can and do get better and recover from addiction. Many others prefer to avoid this population and their families because they see their disease as a moral defect versus the chronic disease that it is, or they find little hope in the reality that people can and do get better. You believed in my hope, Jim, and it continues to drive your work today. 3, the patient is never the problem, right?
Yeah.
You always said, people often had a hard time believing me when I said, the patient is never the problem. You believed it. You know that patients can and do get better, and when there is a barrier, It is not a barrier created by the client, but barriers such as a paucity of trained practitioners, substandard care and concern for these patients trying to survive this disease, and at times a lack of weakened policies to support the providers in providing the best level of and safest care possible to improve outcomes. Among a few others, Jim, these were the central truths that drove my practice, my teaching, and decisions over the years, and it never steered me wrong. And I can see these central truths also drive your practice, your teaching, and your decisions today. And these will never steer you wrong either. Hang on to these truths, Jim. Keep your servant's heart, and keep up the hard and important work you are doing. Congratulations.
We're very fortunate to have Dr. Berry at the Rockefeller Neuroscience Institute in our state. He's a compassionate physician, an educator, and an innovator who tirelessly works to improve the lives of those with mental health disorders. Congratulations, Dr. Berry, on this well-deserved recognition.
Jim, your WVU Medicine family is incredibly grateful to you for all that you do, and congratulations on this well-deserved award.
I can't think of a better person to win this award. Jim is just the kind of guy that other people in addiction medicine want to emulate. They emulate him because of the data, they emulate him because of his caring and compassion, and they emulate him because he's been just a leader in our field for so long. So thank you, Jim Berry, and congratulations.
As a leader taking care of his own people like family, as a physician who takes care of our state's residents like family, and as a state leader who is making the world better for all West Virginians, Jim, we owe you a debt of gratitude and a hearty congratulations.
I'm so proud of you. Very good. Proud of you.
Congratulations, Jim. Take care.
Oh, Dr. Berry, such a moving video, just going through all the amazing recordings that your colleagues sent to us was just quite a testament to you. So thank you for the work that you do. It's a true honor to be able to present you with which we sent in the mail, with the Pillar of Excellence Award 2021. I love the one quote in here that you have the heart to lead, and so many do look to you and your leadership, and we're incredibly grateful for you.
Wow, that was quite a piece to witness, and very powerful. So thank you, Jess and team, for putting that together. As you know, this has been an incredibly tough year for many of us in the healthcare field, and especially many of us who are working with folks with substance use disorders. And as Dr. Volkoff was able to show, some of the data this past year and a half. And so not only are we dealing with the COVID deaths, but we have been dealing with unprecedented rates of overdose. So she showed you the national data that there's been a 30% increase in overdose deaths across the country. In West Virginia, sadly, there's been a 50% increase. And so not a week goes by where we don't know somebody who's died from an overdose. And so sorry. So that gets tough. It's a burden, and being able to take a moment and reflect upon what this work means. And my career is a gift. The overwhelming feeling that I get as I've been able to reflect upon this is that is one of gratitude, of having the privilege to be able to work with this group of people in this population. When I went to medical school, I never ever thought that I would be doing this for my career. The last rotation I had in medical school happened to be a rotation with a group of addiction providers and patients, and it transformed my life. I was able to witness people in the most vulnerable states as you can imagine, and then be with them and follow them in their journey and see transformation take place. And as Raleigh Sullivan, my mentor, mentioned earlier, there is no other area of medicine where you can see such a dramatic and powerful transformation take place. And it is truly a gift to take part in that. And think of all the various things that I could be doing or the jobs that I could be doing, but the fact that I get to hear on a regular basis, you saved my life, and that is amazing. I also, one of the gifts I receive from my patients is I have a front row seat to nobility and resiliency. I think of just a patient, for example, who's a single mother who started using at a very young age, and that I'm seeing people who are coming in for treatment who started using earlier and earlier in life. So now most of the people that I'm treating had started using when they were 8, 9, 10 years old. And so to think of this woman who found release pretty quickly by using substances because she was abused and had to suffer through that, is an abusive relationship now and is doing the best she can to raise her kids and battle this addiction. And to watch as she does that and to stay sober one more day, knowing that every ounce of her being, every cell in her body is screaming for relief, yet still being able to work through that and to be able to be victorious, or if she were to fall occasionally, to learn from those mistakes and to keep going. And I have a front row seat to that every day. And it helps me with my own challenges and circumstances, and it's a privilege. The other thing I'm grateful for is my mentors who were able to devote and pour themselves into me and the work that I do, and that I'm able to carry on, especially Raleigh Sullivan, who you saw today, who's played a big part in who I'm about. And so Raleigh, every patient that I'm treating right now, you're there. The third thing that I'm really grateful for is my team. And you met Katie, who's just one of our team members. But when I think of a pillar, and I think of what a pillar can do, and so you got, one pillar can carry so much, and if the burden becomes too strong, that pillar is going to crumble. And if you have a number of pillars, then you're able to carry mountains. And I have been blessed, truly blessed, with having the most creative, most compassionate, most caring team members on the planet. And I think of an Irish proverb that says, it's in the shelter of others that we exist. And if it weren't for my team members, I don't know how I would exist, but we've been able to work together to really extend this shelter for our communities and for others. So let me just stop crying and babbling and everything, and just say how grateful I am for this award, because it's allowed me to reflect a little bit on myself and my career, and why we do what we do in very hard and difficult circumstances. So thank you to Addiction Policy Forum. Thank you to everyone who was able to put that video together. I was not expecting that, and it took me in a place where I didn't think I would go right now. And most gratefully for all of the folks who are working in this field. Please continue to do what you do. I know it's been hard. I'm there. I keep doing it, keep doing it, and keep doing it. And let's rely on one another. It's worth it. So thank you, Jess and team.
Thank you, Dr. Berry. We are so grateful that we get to kick off our Pillar Awards for 2 days with this award for you. It's such a small thing that we can do, and a moment we can take for such an amazing career, and it's so well deserved. So we thank you for all that you do. For those of you that aren't aware, Dr. Berry is also one of the physicians that is really helping us to tackle stigma on the ground. Our stigma intervention program, which is called Encompass, that we've been working on with the governor of Ohio, it features Dr. Berry. We have comments that have come in about the doctor with the mustache and how helpful he was, and your kindness, Dr. Berry, and your amazing bedside manner and ability to be compassionate, but also explain complicated things in a way that really makes it understandable, and to see people, to really be seen, has helped us really tackle stigma with the program that we're really proud of. And it's doctors like you that give us hope that we are going to keep pushing forward to change what it feels like when this illness hits your family, and to really change the care that all patients have access to. So thank you so much for all that you do. We're going to post the video and send it around to folks. It's just exciting that we got to spend a few moments with you with a heartfelt thank you from our whole team here at APF and our entire network.
Jess, could I just make a comment?
Absolutely.
Yeah, Dr. Berry, this is Judge Rankin. I'm a retired judge. I've been involved in the justice system for 40 years. I haven't had the pleasure to meet you, but I have to. I'll tell you, what I just saw there was such a tribute to you by your colleagues, and your response to the group, if you will, was so powerful. Your compassion is so deep and real that we need a lot more people like you out in the field as far as physicians. And I just felt compelled to tell you that. And I've always believed, quite frankly, that, emotion is not a sign of weakness, it's a sign of strength. And you're a very strong individual. And again, from the bottom of my heart, thank you so much for the work you're doing.
Thank you.